Sara, you can start whenever you're ready.
Okay. So hello, everyone, and welcome. And thank you for joining the Jewish Labor Committee Memorial to the workers who have passed during coronavirus. We're giving folks a few moments to join, and we'll be starting momentarily. So I just want to say hello and welcome again to everyone. And we appreciate you joining us today for this solemn moment as we think about all of the workers who have passed during coronavirus. So we want to thank you very much for joining the Jewish Labor Committee Memorial for workers who have died during coronavirus. We're here today to honor frontline workers who've lost their lives to this pandemic. Many of them workers who went from being all but invisible to being labeled essential overnight. It's easy to get lost in the numbers. More than 4.3 million confirmed cases in the United States. 150,000 deaths. 5 straight days with more than 1,000 deaths. But because of the nature of this pandemic, we have few opportunities to mourn those that we've lost. We can't gather together to celebrate our loved ones and support one another, much less to share the collective pain of so much loss. And while we have deemed millions of workers as essential, so that the key functions of our economy will continue, our country as a whole has neither treated them as essential in life nor honored them as they deserve in death. Coronavirus was real for the people that I represent before it was front page headline news. Flight attendants are on the front lines of all communicable diseases, and our members who fly to China and East Asia were already on alert in early January. Thanks to the training we fought for and won 10 years ago, a culture of safety in our workplace, and early and fast work by our union, flight attendants were better prepared to limit the risk of spread in our workplace. Even though we haven't seen the same rate of infection faced by workers in far too many jobs, we have not been unscathed. Just last week, Jeff Kurtzman, a flight attendant at Hawaiian Airlines, was taken by the disease after he contracted it at an airline training course. He's not the first. We've lost 11 flight attendants so far, and the sad reality is he will likely not be the last. I was raised in the Christian Science Church, but I am honored to moderate this service for Tisha B'Av. And this Jewish day of mourning starts in a little more than a day from now. Today, I'm honored to moderate this conversation hosted by the Jewish Labor Committee, a bridge linking unions, the labor movement, and the Jewish community. I'm grateful to the JLC, our panelists, and all of you for this opportunity to share a moment of mourning, to honor those who we've lost, and to find human connection together in this strange time. I'd like to turn it over to Rabbi Penzner to talk a little bit more about what this day means and why we're here together today.
Thank you, Sara. Thank you all for being here. I'm honored to be part of this very important memorial for workers and as a representative of the Jewish Labor Committee. In the old city of Jerusalem, where today you can shop, play, study, meet with friends, if you walk down one of the narrow alleys, you'll come to a very old house, a house that was built some 2,000 years ago. All that's left of that house are a few stones from its walls. They call it the burnt house. When this house was built, those stones were like all the other stones of Jerusalem, sturdy, carved, and golden hued. But today, they are charred and black, remnants of the great destruction of the city of Jerusalem that took place 19.5 centuries ago in the year 70. The stones tell the story of a great burning, the burning of the houses and shops of the grand city of Jerusalem, and most importantly to the Jewish people, the destruction of the Holy Temple, the place where Jews gathered and celebrated and mourned and confessed their sins. Of course, along with all the devastation of the buildings in the city of Jerusalem, masses of people, from the oldest elder to the youngest babe, died. The lucky survivors were driven from their homes and became refugees in foreign lands. The Jewish people recall that destruction and observe a day of mourning and fasting every year for all that was lost so long ago. That observance takes place this Wednesday evening and all day Thursday. It is known simply by the date it occurred, Tisha B'Av, the 9th day of the summer month of Av. For the past 2,000 years, this date has been the lowest point on the Jewish calendar. What is the purpose of remembering such sadness? Why continue to fast in memory of people so many generations long past? And how do their lives have any impact on our own? In this year of global disruption to our lives, when we witness a human toll and economic decline worse than any we've known in our lifetimes, as we experience a pandemic that could have been prevented, might have been mitigated, and should be feared in its insidious spread across borders, the stories of destruction that we recall on Tisha B'Av feel very real. The stones of the burnt house tell us stories of others who died needlessly. The people who lived in that house were well off and comfortable, and they ignored the warnings of imminent destruction. After Jerusalem was destroyed, the city that was once filled with people became empty. The families who once thrived were broken, and the death toll was unbearable. Today, in the spirit of Tisha B'Av, the Jewish Labor Committee mourns the losses of those on the front lines, the nurses and doctors and caregivers and EMTs who did all they could to stop the pandemic, to treat the sick, to protect the vulnerable. And we mourn the needless deaths of factory workers and transportation workers and farm workers whose jobs were deemed essential to our country, but were apparently not valued enough to be protected from the virus. We mourn those who chose to risk their lives, as well as those who had no choice. What stones will tell their stories? For now, it is up to us to say their names and remember their lives. Their lives were essential. Their deaths were not.
Thank you so much, Rabbi Penzner. It's fitting now that our first speaker sees the ravages of coronavirus in ways many of us never will. As a registered nurse, Jean Ross and her colleagues work every day to keep the numbers from growing, all the while risking contracting the virus themselves. Thank you, Jean, for being here.
Good afternoon. My name is Jean Ross. I've been a registered nurse for over 46 years in Minnesota, and I'm president of National Nurses United, the largest union of registered nurses in the United States. I would first like to thank the Jewish Labor Committee for putting on this event and for giving me the opportunity to speak, and to recognize our Jewish brothers and sisters who are marking Tisha B'Av, a day of mourning and recognizing past tragedies, while reflecting on the suffering that still takes place in the world today. I'm here to discuss what nurses are facing in our country as we continue to battle COVID-19. During this pandemic, frontline registered nurses and other healthcare workers have been risking their lives to care for patients every single day. We face challenges not only from the novel coronavirus itself, but also from a for-profit healthcare industry that has prioritized protecting hospital and insurance company bottom lines over the health and safety of patients and workers, and a government that has shown itself to be an abysmal failure at its #1 job, protecting the health, lives, and security of the American people. Indeed, this pandemic has laid bare the deep failures of our fractured health system. The failure of employers and our federal and state governments has created an incalculable loss of life and hardship in our nation. Hardest hit are communities of color and the economically disadvantaged. The most pervasive disparities are observed among African Americans, Latinx communities, as well as American Indian, Alaska Native, and Pacific Islander populations. And we are seeing the fallacy of linking whether one has health care to one's employment at a time when millions are losing their jobs. As everyone knows, in the past few weeks, we have seen surges of COVID-19 in cities across the US, caused in large measure by the decisions by governors to prematurely reopen their economies, strongly pushed by President Trump. Hospitals in many states are being overwhelmed, and very little is being done to change this course. As the situation grows more dire, President Trump is moving in the wrong direction. He is working to defund testing for COVID-19. Vice President Pence even had the gall to claim that healthcare workers are not getting infected. That's a total lie. Our federal government has removed data from the Centers for Disease Control website, and it is no longer accessible to the public. The Trump administration and way too many governors continue to push for the reopening of businesses and the reopening of schools in a manner that's going to put students and teachers at great risk and further spread the virus. For months now, nurses across the country have been caring for patients during this pandemic without the optimal personal protective equipment, the PPE, we need to do our job safely. Despite all of the discussion and media attention surrounding the lack of PPE, we still are not getting the right equipment and are being asked to unsafely reuse equipment that has undergone so-called decontamination processes that are scientifically unproven and unsafe. As a result, nurses, doctors, and other healthcare workers are constantly being put at risk of exposure to COVID-19 unnecessarily, and many have become sick, and many of those have died. Nurses are living with the constant fear of bringing the virus home to their families, with many quarantining away from their children and spouses for months just in order to protect them. I'm heartbroken to report that 164 RNs have lost their lives in the US alone to this pandemic. And I want to stress that number is undoubtedly much understated, as these are just the nurses and healthcare workers whose names we know. There are no doubt many more who have died, whose names we do not yet know. The CDC estimates that as many as 20% of all infected people in the United States are healthcare workers. We have been called heroes, but we found out in Trump's America, that means we are expendable. Well, I'm here to tell everyone we are not expendable, and we refuse to accept this utter disregard for our health and safety. Nurses are fighting back. We are fighting in the legislative and regulatory arenas, and we are taking that fight to the streets. So far, National Nurses United has held more than 400 socially distanced actions, including over 160 on May Day alone, to call out our employers and the government for failing to protect us and to provide us optimal PPE and safe workplaces. We held 2 protests in front of the White House, one just last week at the US Capitol, placing on the Capitol lawn 164 pairs of nurses' shoes to remember those nurses who have died and to demand that Congress take immediate action. And we will be holding another National Day of Action on August 5th. We have implored our employers, the World Health Organization, the CDC, the Trump White House, federal OSHA, state OSHAs, governors, and the US Congress to provide the highest level of protections for nurses and other healthcare workers. National Nurses United has been sounding the alarm about COVID-19 since January. But here we are, late July, the 7th month that we have been demanding employers and the government work to get us the PPE that we need and deserve. It did not have to be this way. Our hospitals and government should have been better prepared with stockpiles and protective equipment. The entire medical supply chain lacks coordination and transparency, and it is no better off than when the pandemic began. OSHA could have responded positively to NNU's March 5th petition demanding an emergency temporary standard, one for healthcare workers, so that all hospitals were required to provide the optimal PPE. But instead, OSHA just tossed our petition aside. The CDC could have listened to registered nurses about the PPE required, instead of continually downgrading its guidance to let hospital employers off the hook. It seems to be lost on many in power that if nurses become sick, there will be no one left to take care of our patients. In order to protect patients, you have to protect nurses. Nurses need optimal PPE in their hands. We need it now, today. That's why we need Congress to act immediately. On May 15th, the U.S. House of Representatives passed the HEROES Act, a $3 trillion bill that would provide desperately needed economic help to American working families and to state, local, and tribal governments and to the U.S. Post Office. This legislation includes a provision that would mandate the Occupational Safety and Health Administration, OSHA, to promulgate an emergency temporary standard to ensure that employers protect essential workers. That includes registered nurses during the COVID-19 pandemic. And this legislation would also ensure the increased production and delivery of PPE and other medical supplies. Through the use of the Defense Production Act and new systems for reporting transparency and coordination of supply chain logistics, something that nurses have been demanding for months now. The House did the right thing on May 15th, and for the subsequent 10 weeks, Senate Majority Leader Mitch McConnell did nothing. He sat on his hands. He even called a recess and went on vacation. Yesterday, he finally released the Senate Republicans' proposal, and it's a joke and an insult to America's workers, including registered nurses on the front lines of this pandemic. For everyone watching and listening today, we strongly urge you to contact both your U.S. senators and urge them to pass the House-passed HEROES Act. Do this instead, including the OSHA standard and the provisions to fully utilize the Defense Production Act, the DPA. You can use the NNU's hotline number to call both senators. That number is 202-335-6015. Let me read that again. Please call 202-335-6015 to urge your senators to pass the HEROES Act in full. Let me say in closing, as a registered nurse, along with other healthcare worker colleagues, we did not go into a caring profession so that we could sacrifice our own lives for no reason. We went through an extensive education on how to care for patients because we have the intelligence, the heart, and the passion to protect and advocate for people. It is imperative that we demand our employers and the United States government do everything in their power to protect us. Now, more than ever, solidarity is needed, and NNURNs are proud to stand with you in unity. It is truly a matter of life and death. Thank you.
Thank you so much, Jean, and thank you so much for bringing the stories forward. If we did not have our unions to tell these stories, tell the truth, bring people together in action for love, pushing hate speech aside, and filling up all spaces with love, we would not be able to care for people. And your work and the work of every healthcare worker, from doctors and nurses to respiratory therapists, X-ray and lab techs, PAs, CNMs, janitorial, service and maintenance staff, and everyone who is working in unimaginable conditions to keep our hospitals and our clinics running, but also to be coordinated through our unions and raise our voices when there's something wrong and call people to action and expect of our government action to take care of our people. Thank you. Food service jobs went from invisible to essential overnight. COVID has cast a harsh light on the reality of work for so many, and especially for the people who work in our processing plants. I'd like to introduce Mona Darby, a shop steward for RWDSU, representing poultry processing workers, to share her story about what she and her colleagues face.
Good evening, everyone. My name is Mona Darby, and I work for Wayne Farm Fresh Plant in Decatur, Alabama. I have been there 32 years next month. I'll be there 32 years. And we have over 600, a little over 600 employees there. But we have 100 people have had the COVID-19, including myself. I think I was one out of the top 10 that's had it. I did, including myself. So yes, it's something to go through. You know, are we scared? Yes, we're scared. We're very afraid because we don't know who to trust anymore. We don't, all the lies been told in our president. So it's just hard. It just don't know who to trust. So it's something to do with anybody on here that ever done had the COVID. Then we know how, you know what we done experienced, what we done endured going through this. It's a challenging thing. And then you have to stay away from your families and loved ones. So it's something to go through.
Thank you, Mona. It's powerful and heartbreaking also to hear your story and the story of so many workers across the country in food processing and what you face. It's important that we remember these aren't isolated or rare. Many outbreaks of coronavirus have been tied to meat processing plants, where workers are made to work in dangerous conditions during normal times. But during the pandemic, their workplace has too often become a super spreader of sites. Next, I'd like to introduce Gladys Betancourt, an apartment cleaner represented by SEIU Local 32BJ. Domestic workers are in double jeopardy like other essential workers in the pandemic. Their work requires them to be in close contact with others, in this case, literally in other people's living spaces. So they are forced to choose between their safety and their basic needs. In March, Gladys lost a colleague to coronavirus, and she joins us today to share how the pandemic is affecting her and her colleagues. Thank you for joining us, Gladys.
Gladys, you're muted if you're speaking. Please go ahead and unmute yourself and share your webcam.
Mi nombre es Gladys Betancourt y soy una trabajadora esencial de limpieza. ¿Ya? Mi nombre es Gladys Betancourt y soy una trabajadora esencial de limpieza en un edificio de apartamentos de lujo en Jersey City, en el estado de New Jersey.
My name is Gladys Betancourt. I am a porter in one of the luxurious apartment buildings in Jersey City, New Jersey.
Por un salario mínimo, sin beneficios significativos.
We don't have any benefits, and the ones that we have are very insignificant and very small and very low wages.
En diciembre del 2019, mis compañeros de trabajo y yo votamos por la local 32BJ.
On last year, me and my coworkers, we voted for 32BJ to be the union to represent us.
Y fueron para que fuera nuestro sindicato, y la votación fue
we voted and it was 12-0. All of our coworkers agreed to have 32BJ representing us.
este año, cuando el COVID comenzó a golpear a Nueva Jersey, nuestro empleador Planet nos designó como trabajadores esenciales nos designó trabajadores esenciales.
And this year, when COVID started affecting New Jersey, our employer Plant made us essential workers.
Muchos de los residentes de los apartamentos se quedaron en casa y nuestra carga de trabajo se hizo cada vez más pesada.
Many residents stayed at home, they work from home, and the amount of work that we had to do increased.
A principios de abril, uno de mis compañeros de trabajo, el señor Darío, también trabajando en limpieza, fue diagnosticado con el COVID-19 y lamentablemente falleció.
At the beginning of April, one of our coworkers, his name was Darío, he was, unfortunately, he got COVID and he passed away.
Aún así, sorprendidos por la pérdida de nuestro compañero de trabajo,
and we were very moved and surprised with the loss of our coworkers.
Temíamos por nuestras propias vidas, ya que todos habíamos trabajado a su lado las semanas anteriores.
We also feared for our own lives because we worked along him for the few weeks before he unfortunately passed.
La mayoría de nosotros no tenemos seguro médico, ya que Plane solo ofrece uno muy costoso, no lo podemos pagar.
Most of our coworkers and myself included, we don't have health insurance because our employer offers a very expensive health insurance plan and we cannot afford it.
Con nuestro sindicato, la local 32BJ, exigimos que nos enviaran a casa a la cuarentena con pago.
Me and my coworkers alone and with the support of 32BJ, we fought so that the company would give us 2 weeks of quarantine with pay.
Plane inicialmente dijo que no, pero nos mantuvimos unidos y ganamos 2 semanas de cuarentena pagadas.
We remained strong even though the company said no, and we still kept fighting, and then the company agreed to give us the 2 weeks off and with pay.
Luego, el mes pasado, el dueño de nuestro edificio echó a Plane Company y trajo a otra compañía llamada Attendants.
And last month, our employer, planned companies, and the owner ended their contract. The owner of the building ended their contract, and the owner of the building brought in a new company named Attendants.
La cual se negó a contratarnos a nosotros, a darnos el trabajo, que siguiéramos trabajando.
And Attendants refused to hire us and to allow us to keep doing our jobs.
Planes continúa luchando con la local 32BJ para recuperar nuestros trabajos y recibir un pago por lo menos por los meses que hemos estado fuera.
the workers of the Beacon, we continue fighting with the local 32 BJ. They keep supporting us so that we can get our jobs back or that we can get payback for all these months that we haven't been able to work.
Pues ya que hemos arriesgado nuestra vida, aún así sabiendo lo que estamos viviendo y aún estamos con la 32 BJ luchando con planes para que nos devuelvan nuestro trabajo, ya que nosotros hemos sido empleados esenciales y no es justo lo que nos hizo Planet 20. Nos dejaron sin trabajo, no les importó nada.
And we continue fighting again with 32 BJ against Planned so that they can take responsibility for the things they've done. We risk our lives. We are essential workers, but they did not treat us as such. Thank you very much.
Thank you.
Thank you, Gladys, so much. And thank you for joining our union family with 32 BJ. Thank you for fighting. Thank you for fighting in the name of those that you've lost and fighting for each other who are living today. And we are with you, and we are grateful for your stories. Next, I'm honored to welcome my big-hearted, welcoming, loving brother, Stuart Appelbaum, President of the Jewish Labor Committee and Executive Vice President of RWDSU. Welcome, Stuart.
Stuart, you need to share your webcam and unmute yourself, please.
Thank you, Sara. First of all, I want to thank all of you for being involved in today's event. And I want to thank the New England JLC for the extraordinary work it does all the time. The world has changed in ways that we never contemplated or even believed could be possible. As of today, the United States has recorded over 150,000 deaths from coronavirus. 150,000 families are mourning. And the pandemic has raised the curtain on inequalities and injustices that have always existed, but now have only been exacerbated. And that is especially true for racial injustice, as we have seen the impact of the pandemic on communities of color. You heard from Mona today, who is a member of my union. Many members of my union were deemed essential workers from the beginning. Workers in supermarkets and drugstores, airline caterers, and in poultry processing plants. And our society would not have been able to function without them. And these workers have gone to work every day, frightened to go to work, frightened of being exposed to the virus and of being infected and of infecting their families, but also frightened of not going to work because otherwise they wouldn't be able to support their families. And all too often, their employers failed them, doing too little and too late. We had to force them. We had to publicly shame them to do better. But almost 4 dozen members of my union across all of our industries have died already. In poultry plants in the Southeast United States, employers treated our members as dispensable. These employers were more concerned about the chicken these workers were processing than the workers themselves. The companies were late in providing PPE. They provided bonuses based on attendance, which incentivized people to come to work even when they might be sick. They failed to provide adequate paid time off if somebody needed to quarantine. They failed to provide testing. People work elbow to elbow in poultry plants, trying to keep up with the pace of the lines in these plants. But in one plant, the company put up saran wrap barriers instead of plexiglass. In another plant, the company claimed that they only had enough PPE for supervisors and not for the workers on the line. We brought this to the attention of the national media and forced these employers to change. Gene Ross this afternoon talked about the Defense Production Act and how it needed to be invoked to produce PPE, to produce testing supplies. Trump wouldn't do it for that, but he did invoke the Defense Production Act to require poultry plants to stay open when local and state authorities wanted to shut them down temporarily because they had become hotspots, because these plants needed to be cleaned, a deep cleaning to save people's lives. That's when Trump invoked the Defense Production Act. And what he did there resulted in more people dying. It was the absolutely wrong thing to do. As unions, we mourn for the dead, and we fight like hell for the living. That's what my union and many others have been doing since this pandemic started. And that is what the JLC has been doing as well. We have been raising our voices and fighting for resources for people in need. We helped arrange funding and direct payment for a number of groups of excluded workers who were unable to qualify for federal resources because of their immigration status. People who desperately needed support, such as nail salon workers and car wash workers and farm workers. We obtained support for Union Settlement, the largest and oldest social service provider in East Harlem, so that it could expand the number of recipients of the Meals on Wheels program and to provide emergency cash payment to clients who have lost income and were facing crisis situations. We arranged for funding through a Jewish family foundation for the immigrant organization Make the Road, which operates food pantries, gave gift cards, and provided health services to immigrant families. We worked with the Bergen Family Center in Englewood, New Jersey, to help provide prepared meals, personal hygiene products, and supermarket gift cards for people who are often homebound or sick or both. And in Baltimore, Maryland, we worked with Johns Hopkins Medicine for the Greater Good to help distribute meals and sanitation supplies. And we advocate. We have worked to get our members and friends to advocate in support of the HEROES Act and to get the Senate to support the Act's principles and priorities, which our country desperately needs. We joined with the New Jersey Citizen Actions Campaign to urge representatives in Trenton to fill in the gaps and to guarantee protections for all workers, including emergency paid sick days, expanded paid family leave, and expanded unemployment insurance. And here in New England, the JLC is an active member of the Massachusetts COVID-19 Response Alliance, pushing a successful eviction moratorium, among other provisions, like emergency paid sick leave, which still needs to be won. And the New England JLC supported May Day strikes for gig workers, and it stood with Unite Here 26 members who experienced police violence. and helped on turnout for a Black Lives Matter event in Lynn, Massachusetts. There has never been more that needed to be done as we face 3 crises simultaneously: the virus, economic collapse, and racial injustice. And we must do everything we can to help build a better world, and not just to return to the world that existed prior to the pandemic. Even as we mourn deeply for those who are gone, many of whom lost their lives unnecessarily because of government and employer failures, we commit ourselves to one thing we absolutely must do, especially after November, and that is to work to revive our nation's historic journey towards justice and equality for all. Right now, we are mourning, but we know we are not going to stop fighting. Thank you all. Thank you for being part of this today. Thank you for the work you are going to be doing once today's event is over. Thank you.
And Rabbi Penzner, can you lead us in a Kaddish, the mourner's prayer, please?
First, I want to say to Gladys, gracias, lo siento, tu pérdida. Thank you to Jean and to Mona, to all of your colleagues. I extend my deepest condolences. In Jewish practice, one who mourns the death of a loved one recites an ancient prayer in an ancient language in Aramaic to lift up their souls, as well as to comfort our own. In reciting the Kaddish for mourners, we do not dwell on our sorrow or our loss. In fact, these words prod us to continue to carry our loved ones' legacies, to fight their fights, and to live their dreams. As I recite the Mourner's Kaddish for all those who've been on the front lines of the COVID pandemic and who have lost their lives as a result, I urge each of you to hold in your heart the names of anyone you have lost, so that our prayer can lift them up and bring comfort to all who mourn. And I invite you to stand with me if you choose. Yitgadal v'yitkadash shemei Rabba, be'alama divrach hirutei v'yamlich malchutei, b'chayefon v'yomechon, u'b'chayedecho beit Yisrael, ba'agala u'bizman kari v'meru, amen. Yehei shemei Rabba mevarach le'olama la'olmei olmaya. Yitbarach v'yishtabach v'yitpa'ar v'yitramam v'yitnaseh, v'yithadar v'yit'aleh v'yithalal shemei dekudesha b'richu. La'ela min kol birchata v'shirata tushbachata v'nechamata damiran be'alma v'imru. Amen. Yehei shlama Rabba min shamaya v'chaim aleinu v'al kol Yisrael v'imru. Amen. Oseh shalom v'imromav. Hu ya'aseh shalom aleinu ve'al kol Yisrael ve'al kol yoshvei tevel v'imru. And we all say, Amen.
Thank you so much, Rabbi Penzner, for that prayer and for your loving condolences and comfort to all of us. And thank you to Jean, Mona, Gladys, and Stuart for helping us mourn your colleagues and all the workers who have been taken by this pandemic. As Stuart said, echoing Mother Jones, mourn the dead, fight like hell for the living. And we do that with love. Well, love rests in action. So we're going to close out with some action for you. Please take note. If you're not already a member, please join the Jewish Labor Committee. In this time where our country and indeed our world face rising fascism and authoritarianism, their work to serve as a bridge between the Jewish community and organized labor to fight for economic and social justice is critical to our ability to beat back the forces of nationalism and corporatization to create a just world for all of us, and the promise, and the full promise, that this country was originally built on. As we watch the virus rise again and take hold of our country, we need our leaders to act to prevent a complete catastrophe in our economy and to fight against the pandemic. Mitch McConnell just introduced a bill that would allow businesses to sue customers and workers who fall ill, but would protect those same businesses from lawsuits brought by customers or workers who are exposed through business negligence. Some Republicans don't want to do anything at all. They want us to choose to work and to serve over our own lives. The Republicans have shown their complete contempt for working people once again, and we must stand together to demand that they pass the HEROES Act to ensure that we can beat this virus and save our economy. Please call your senators to demand that they pass the HEROES Act and the aviation payroll protection and any additional vital aid that has become obviously necessary since the House took action so long ago. Call your senators and ask them to act without delay. I want to thank you all for joining. I was honored to serve as moderator today alongside these wonderful champions for workers and workers themselves who are continuing to risk their lives doing the essential work, as all work is essential. Thank you for this opportunity and the opportunity to mourn with all of you and connect in this way. We have more work to do together, and we will do it in solidarity always. Thank you, and stay safe.